everyone, my name is Michelle Petite, and this is the start of my YouTube channel. I have been intending to start this forever, but finally I have a good reason to. So I just graduated from my master's program in speech language pathology at LSU, and I start my clinical fellowship year, even though it's not really called that. It's just called the CF now. They dropped the Y. I start my CF tomorrow at a hospital. I will be in acute care. And so I am compelled to start this YouTube page to kind of bring to light what it is to be a speech language pathologist. Oftentimes, to all my speechies out there who are in the program, who have been practicing for years, when you tell someone who's unfamiliar with our field that you're a speech language pathologist, they'll say, oh, so you help people with their speech. And granted, that's a small aspect of what we do. I want to take the opportunity to bring to light all of the awesome things and the broad range of specialties and disorders that we see and that we take care of. I originally entered into grad school thinking I was going to go into peds, but I fell in love with the science and the medicine and the complexities of cognition and voice disorders and swallowing. And so I want to take you with me if you want to tag along. This is for anybody who is in a speech program, who is thinking about a speech program, someone who's already been practicing speech for like 10, 20 years, but maybe is in a school setting or maybe is in a skilled nursing facility setting. I want to bring to light what it is like to be in a acute care setting. So when I was first looking into acute care settings, I was reading up on blogs about what is the likelihood or how to get into an acute care setting. And the results were few and kind of dismal. They were saying that they're hard to come by, especially as a CF, because all the time and the money they spend training you is kind of not worth, just finding someone who already has experience. But you need experience in order to have experience. So this position has truly been a blessing. And if I had to encourage anyone who is thinking about acute care, who's thinking about the medical side of speech pathology, I would say be open and be willing to travel anywhere, case in point. They are hard to come by. However, if you're in grad school right now, request for those medical clinical practicums, request to be at a hospital, request to be in any sort of setting which is going to expose you to dysphagia or dysphagia. I say dysphagia to feel fancy. To dysphagia, to cognition, to, right hemisphere, aphasia, any one of those things which have a more, medical inclination, grab onto it just to get a feel for it. Even if you're a peds person, even if you're going to be in a school setting, still expose yourself to those sorts of things. Because I've been working with kids since I was like 14. And, I figured that I would get my master's and continue on and, go and work in a school setting. And I still love peds. I still love peds and I still want to do that. But right now I recognize the crucial time that the clinical fellowship year is. This is the only time in which I'm going to get additional supervision. After that, I have my C's, and anyone who looks at the letters behind my name is going to assume that I have that experience. So if you can, go for a acute care setting or go for, an outpatient and be open. So I'm going to be open, and you guys are going to be here with me, traveling with me. If you have any questions or comments or anything that you want for me to include, comment below, and I will talk to you soon.